Um, Hi, my name's Angelica. I'm a nursing student. Do you have time to give me SBAR?
Yeah, I do. We're taking care of Marta Yarn. She's a Hispanic female. She's in room 529. She has no known allergies. She's a full coat. Her doctor's Dr. Jolly. Um, she was admitted for a non healing sacral ulcer, um, and it's a stage 3. She has multiple admits for dehydration and pneumonia. Her last admit was 6 months ago. She's widowed. She lives in a senior apartment. She has 2 kids that live across the country. We really don't have much of a family history on her. She has a lower back pain level of 6. We did give her some pain medication, and we're about 5 minutes ago, and we're waiting for that to work. So we'll assess her pain. She has generalized weakness. She denies numbness beyond the sacral area. Her gait's slow, but she uses a walker inside and outside the home. And her she's non-smoker, and like I said, she had multiple admits for the pneumonia. No long-term oxygen in the past, and her lungs are clear to auscultation, but she does have diminished sounds in the anterior and posterior lobes. She has no heart disease, denies chest pain or palpitations, no shortness of breath, no syncope. Sinus rhythm, has some immature beats. She has no nausea or vomiting or change in her stool pattern. The colors and consistency are normal. She has a regular diet, but she does have a diminished appetite. Currently, she's NPO after midnight. She does suffer from stress incontinence with nocturia. She denies pyuria, hematuria, vaginal bleeding. Her last PAP was 20 years ago. Her intake is 850 and her output is 350 ml. And her urine is clear, amber clear. Um, she does have the non-healing sacral ulcer stage 3. It's a full thickness, tissue loss, some sub-Q fat may be visible. She complains of a dry, scaly skin, and she uses lotion sometimes. She has very poor skin turgor. Her wound has serous exudate with an unusual odor, and it has no undermining or tunneling or bruising. It's 4 by 4 by 1 centimeter, and she's scheduled for a surgical debridement tomorrow. Her vital signs are her temp is 99.1, heart rate's 88, her O2 stat's 92, and her BP is 140 over 90. She does have an IV in her right dorsal metacarpal, and we're giving her IV fluids of zero point 0.9 normal saline. She does have an EKG and an X-ray pending. We did do some labs. We did a wound culture, and it came back for E. coli with gram-negative rods. That's why we're giving her the gentamicin. That I don't know if I told you, but we're going to be giving her an antibiotic, gentamicin. She has a fasting blood glucose of 101, and her white blood count's a little elevated, 12,500, and her albumin's a little bit low at 3.1. So, do you have any questions for me?
Yes. Why specifically is the client receiving this medication?
Well, she's receiving the medication because of her pressure ulcer and because her white count was elevated, and her culture did come back positive for the E. coli and negative rods. I'm sorry.
Okay. What action does the medication have on the body?
Well, it's bactericidal in action, and it inhibits the bacterial protein synthesis of the cells.
So when should you question administering the medication?
Well, if the patient were pregnant or taking other antibiotics or had an allergy or a hypersensitivity to aminoglycosides, if she has renal impairment, things like that.
Does the medication have a therapeutic serum level?
5 to 10 micrograms per milliliter.
Okay. And which vital signs must be monitored?
Pretty much all of your vital signs, but particularly her eyes and nose.
Okay. Which physiological parameters should be monitored when the medication is being administered?
Well, we need to make sure she doesn't develop a rash, have blistering of the skin, itching, hives, swelling of the eyes, face, and throat, in tongue or lips, or difficulty breathing or swallowing, or hoarseness.
Okay. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Well, the patient needs to advise the doctor if she's ever had cystic fibrosis, problems with her muscles such as myasthenia gravis or Parkinson's disease.
Oh, okay. What interventions must be taught for taking the medication safely at home?
She needs to keep a list of all her medications, prescription and non-prescription.
Okay. And what are the side effects and potential adverse reactions?
There's quite a few. Ataxia, vertigo, nausea, vomiting, diarrhea, decreased appetite, pain at the injection site, headache, fever, joint pain, and unusual tiredness.
And how will you know the medication is effective?
Well, you'll see resolutions of the sign and symptoms of the infection. And if we don't see that response, then we'll do a new culture in 3 to 5 days.
Okay.
Would you like to go in the room with me while I administer the medication?
Sure.
Okay. Hello, Mrs. Yarn.
Hello.
I'm April. I'm going to be your nurse today.
Okay.
And this is Angelica. She's a level 1 nursing student. And if you don't mind, she's going to accompany me today.
Okay.
And what we're going to be doing is giving you some IV medication and some fluids. So, let's see here. Okay, and I'm just going to wash my hands before we get started.
Mm-hmm.
Move that out of the way a little bit. And can you tell me your name and date of birth?
Marta Yarn, and I'm 80 years old.
Okay. All right. Put on some gloves here. The doctor's ordered gentamicin. Have you ever had this before?
No.
Okay. Do you have any allergies?
No.
Okay, I'm going to make sure I check the orders just to make sure.
Okay.
But just for safety's sake, I noticed you didn't have on a bracelet. So, if you, I see you have an IV. Now I need to check and make sure that it's patent, so I can hang some IV fluid. And do you know why you're getting this medication?
Because of my pain in my back.
No, it's because of your infection. It came back, your ulcer came back positive for some
Oh.
infection, so we're going to give you an antibiotic and some fluids.
Okay.
Okay? All right. So, I'm going to go ahead and hang this saline, give you a little hydration. Okay. I'm going to check the MAR for the doctor's order. Now these bags came pre-mixed and pre-labeled from the pharmacy, so, but I just want to make sure that everything's in order. All right. Okay, so we have sodium chloride, 0.9 with potassium chloride, 2 milliequivalents per 1,000 ml. I'm going to check the bag for color, make sure there's no holes in it, check the doctor's order, and check it against the MAR. And so I'm going to spike the bag, and okay, we're going to make sure that these two things stay sterile. And so I'm spiking the bag, and I'm going to prime it a little bit to make sure we don't have any, oh, we got lots of air bubbles. Some of this line just, okay, let me undo the clamp. All right, let's work those out. Okay, just might take me a minute or two to work these
Okay,
bubbles out of the line, but better get them out than not, so.
Mm-hmm.
Alright. There we go. All right. I knew I'd get it eventually. It's just important to get those air bubbles out of there. So let's just go ahead and set this up. Okay. Make sure that's inside of there. And this is inside of here. Okay. I want to make sure this stays nice and clean. Okay. I'm going to hang that right there. Going to prime it. Okay, turn the system on. All right. So let me just get the medication up here. Okay, we checked the medication. Your armband. All right, turn green. Okay, we're going to be administering this at 125 milliliters per hour. And the right dorsal metacarpal. Okay, we're going to be doing this at 1500. Okay. Okay, so we made sure this was the right patient, the right dose, the right amount, the right time. I checked with the pharmacy, made sure it was the right orders. Okay, so what we're going to do is we're going to piggyback this line on. First I'm going to flush your IV site. Okay. I'm going to make sure that it's patent, and we'll start all this at once. Okay, I'm going to look at the site, make sure there's no redness or swelling. How does it feel, the site?
All right.
It does feel okay? All right. And I'm going to clean the hub for 15 seconds. And we're going to flush this IV just to make sure that it is good and it is patent. It looks great. All right. So we've done that. Okay. And gonna actually hang this bag a little lower, and the machine will know what to do with it. Okay. All right, so I'm going to check your bracelet again. And what's your name and date of birth?
Marta Yarn. I'm 80.
All right, and I'm going to save, we're going to check this medication. All right. Actually, I need to scan your bracelet again. All right. And we're going to scan the medication. And what we're going to do is check the orders against the MAR. Make sure you don't have any allergies. These came in pre-labeled, pre-mixed bags from the pharmacy. But I just want to make sure that it's clear, consistent, the expiration date, and I did check the expiration date on the other bag. So it looks like everything's in order. I'm going to spike the bag, making sure that I don't touch the tube or don't get the tube dirty. And we're going to hang this bag. I'm going to clean the hub. Prime this bag. We're going to open the clamp, prime, get rid of any air bubbles. Okay. Okay, prime that. Looking good. Okay. I'm going to scan this one more time.
Mm-hmm.
All right, that turned green. All right. And I wanted to ask you about your pain level. I know we did give you some pain medication. How's your pain? Because you do have a PRN a prescription for that's as needed for morphine if your pain
Okay.
is bad.
It seems to be improving.
Okay, good. Okay, let me put in your patient ID. Okay, we're going to do basic infusion, and the rate is this is for the saline, it's 125, and we have a 1,000 milliliter bag, so we're going to put in 950 so the pump doesn't run dry. Okay, and we're going to put in the secondary, which is the gentamicin. Okay, it's every 12 hours. And we already have it programmed in at 80 mg for 100 ml, and this is correct. Okay, we're going to hit next to confirm, and we're going to hit start. Okay, it's checking the line. Okay, it seems to be doing well. How does that feel?
Good.
Oh, line occluded. Okay, so let's see why we're having this particular bubbles. Let's get those out of there. Okay. All right. So is your IV site, how does that feel? You doing good? Pain
Feels
level's
fine.
good? Can I get you anything else?
No.
All right, I'm going to put your call light. Okay. I'm going to make sure that you're safe, give you your call light, and then I'm going to just do a little bit of documentation over here.
Okay.
All right. I just want to make sure that we have your medications documented.
Okay.
And I'm also going to document your IV.
All right.
Okay, and I did ask you why you were taking this medication. And you seem to understand, but here's some extra information
Oh, okay.
in
Thank
case
you.
you, and if you have any questions, please ask me. I'll be
Okay.
happy to answer them for you.
All right.
All right, and I'm just going to document your IV here. Okay, we had a 20 gauge needle. Your insertion site was clean and dry, no redness. Flushes easily. Dressings are clean and dry. And you don't have any complaints at this time?
No.
Okay. Okay, just going to document that. And we documented your teaching. And you don't need anything?
Mm-mm.
Okay, well, great. So I'm just going to leave you and, okay, I'll just wash my hands. I always want to make sure we get those hands washed. Okay, thank you for letting me and my nursing student have this learning experience.
Sure, no problem.
Okay. All right. Thank you for helping me. Do you have any more questions?
Yes. So, were there any pertinent pieces of information you reviewed before administering the client's medication?
Well, we reviewed the labs for the status of the infection, and we verified the orders. We made sure that the client didn't have any allergies, and we contacted the pharmacy as well to make sure that there were no allergies, and that it was the right concentration. And we reviewed that the patient isn't hypersensitive to the drug.
Oh, okay. So, did this information affect your decision to administer the medication?
Yes, it did, because everything was in order, so we administered it.
And did this information affect how you administered the medication?
Yes, if anything was incongruent, we would have had to call the physician and get some new orders. But everything seemed to be okay and in line. So
Okay. Well, that's all. Thank you for letting me follow you.
you're welcome. Thank you.
Mm-hmm.